And today the topic I wanted to discuss is what the Lorenzo Adone case tells us about medical advice from non-scientist laypeople during this current time of COVID-19. As per an overview, the topics I'll cover are the case study of Lorenzo Adone, what the research done by his parents tells us on medical advice given by them on ALD. I want to define the role of a prudent layperson within the medical community, which will segue me into the COVID-19 concerns that we are experiencing today, which will allow me to address harmful effects as well as benefits of lay people practicing medicine in general. And then I'll evolve this discussion into a comparison between Lorenzo's oil and the COVID quack cures we are seeing. And this will allow me to answer the question of whose medical advice should we truly trust in general and during the time of COVID-19. So there are a couple reasons for my choice of topic. One is being the relevance of the COVID-19 pandemic that was issued as an emergency by the World Health Organization recently. And this will allow me to really get into the background of whether medical advice should be accepted from these non-scientists that are suggesting cures to COVID-19. Both health experts and lay people are weighing in on the matter, and there is a point that needs to be made that Lorenzo's miracle cure and the quack cures of COVID-19 that I will work into the discussion are very different subject matters, but they can still be cross-examined due to there being a success with Lorenzo's oil, as well as the very opposite effect of failures with current COVID-19 remedies being suggested. A couple key terms I would like to define are a layperson, which is any person possessing an average knowledge of medicine who considers their diagnosis of said medical condition to be correct. Whether it's correct or not, we won't know. That's what a layperson is. A quack is a person who lacks the credentials to be a part of the medical profession, but still pretends anyway to have that said medical skill. And they can practice professionally or publicly. Now, I'm going to get into the background of Lorenzo's oil and this particular case study, where Lorenzo Adone is a 5-year-old diagnosed with adrenoleukodystrophy. His parents are two non-scientists, and they can be considered as two concerned parents with no medical training whatsoever. They're worried about their son. Here's the family in question. The father was an economist at the World Bank. The mother was a linguist, as well as in the advertising profession. And there's Lorenzo. So, adrenoleukodystrophy. The certain type of severe form that Lorenzo had was X-linked, so it was caused by his mother, and it was created by an accumulation of very long-chain fatty acids. The doctor gave the son a prognosis of dying within 2 years, which of course the parents were concerned with. The clinical effects that had begun to affect Lorenzo were he would become mute, deaf, blind, and paralyzed before eventually dying. So the parents went about it by contacting a panel of medical experts through the father's connections. And it was there that they first found out the existence of a dietary supplement that would allow them to reduce the fatty acid inflammation. Michaela and Augusto did everything they could to fast track this cure, since the medical experts weren't too concerned with this set of disease, as it was a particularly rare form of the disease. And so the two parents went about it by using Michaela's sister, who was a carrier of the same X-linked ALD that Lorenzo had. They used her as essentially a test subject to see what dietary supplement would work. They got Don Suddaby involved, who was a British chemist who was working for Croda International Chemicals. Here's the chemical power plant where he helped create the solution of Lorenzo's oil. He mixed oleic acid and erucic acid to create the right blend, and he can't be really considered medically trained as chemist in his profession. At least he was working in a factory, so he wasn't really used to treating patients. But now this next fella actually was used to treating patients in a traditional medical environment. This fella on the left side, dressed in the fancy suit, his name was Hugo Moser. He was actually the one who did diagnose Lorenzo himself. Now this man, as you can see, He was very well qualified to be in the medical profession. He was the president of the Kennedy Krieger Institute, which was a medical facility aimed to treat adolescents with medical disabilities, and he was also a professor of neurology and pediatrics at Johns Hopkins. So these two people helped the Adones create a cure for their son, and it was actually the Adones who ended up being praised for it. They were regarded as the creators of Lorenzo's oil. These two concerned parents without any medical training, they were praised as the creators of a very original cure for ALD at the time. But the story is often dramatized. As you can see, it was created into a movie, Oscar-winning movie. But again, the story was kind of dramatized in a sense. The real life Lorenzo did live with his mind intact, but he still needed lots of care from both his parents and caretakers. And again, the father and mother are still credited with being the creators of Lorenzo's oil. But as we'll soon see, the creation of this miracle cure wasn't as miraculous as once thought to be. But before we get into that, I'm going to discuss findings on COVID-19. So quackery. The prevalence of quacks during the time of COVID-19 really demonstrates a need for concern and caution, especially in the medical community where we're not exactly sure if we could trust non-scientists or whether we should solely trust researchers who are accredited with medical advances. So this has led to COVID-19 paranoia. Fake coronavirus cures are popping up, and this U.S. man named Keith Lawrence began to peddle fake coronavirus prevention pills. The reason why this certain case is being discussed by me is because he was the first to be arrested regarding quack cure for COVID-19, and the overall spread of misinformation for preventing coronavirus is starting to get a hold of us and a hold of our community. Some people, like this man right here, Keith Lawrence, did it for profit, and that has created a real paranoia environment regarding COVID-19 and finding a cure for it. Again, here are the actual prevention methods, washing your hands and not coming into contact with people who are sick. These are real prevention methods. But again, we have leaders who are getting involved with putting their 2 cents in on how they treat it. Country leaders such as Donald Trump, there was a case where he erroneously stated that, there are benefits to injecting disinfectant or exposing yourself to ultraviolets. And that is just false. There's no research that proves said treatment should be effective. It actually could be proved to be more damaging. And the president cited his own use of the drug hydrochloroquine recently to preventing COVID-19, and of course some citizens are going to believe him. And this was to the chagrin of many World Health Organization officials, as well as the U.S.'s own immunological expert, Dr. Fauci. So this leads to my case that authoritative figures must really do more research before giving any info whatsoever, as it could pose a risk to citizens who listen to said misinformation. And misinformation in the time of coronavirus really could be related to any advice given by people who aren't medically trained, which is why I'm going to be segueing back into my Lorenzo Adone case, which really, although it seemed like a successful story on these 2 non-scientist parents developing a cure, even though they didn't have any medical training, I'm going to make the argument that you really need medical experience before giving any true advice whatsoever. And the reason being is because Hugo Moser, again, the one who diagnosed Lorenzo, eventually composed concurrent studies following Lorenzo's case to X-linked ALD that showed the fatty acid buildup and ALD in general was unaffected by Lorenzo's oil if you already showed the signs and there was nothing you could do. So at most, the Lorenzo's oil worked as a treatment for asymptomatic patients who weren't initially showing signs. And so in conclusion, you have to make it known that Adone's miracle cure was not as it has initially seemed. It was developed by 2 non-scientists, and you can't praised it to a platform similar to what our medical professionals are giving us today. And yes, this could be correlated to the idea of quack cures because it segues us into the idea that medical advice must come from medical professionals. We must be wary of all medical advice, especially when non-scientists are giving the info. Again, you need to have the right background. You need to be trained professionally to have a medical degree. And that's going to lead me to my next case, where I could connect this idea of Lorenzo's oil as well as medical advice as well as COVID-19 to there was a book written by H. Tritham Engelhardt, who wrote The Foundations of Bioethics. And he posed the idea of casuistry, which is the use of clever but unsound reasoning, especially in relation to any moral questions. And that can really be related to coronavirus and quack cures. Like it's these cures are you may pose something that sounds clever, but it's really unsound in the pathway of how coronavirus works. You can't trust any of these cures. That's casuistry. As for his definition of intuitionism, which is the theory that primary truths and principles are directly guided by intuition alone, that relates to the Lorenzo Adone case. The Adones really believed in their intuition in getting out a cure for their son, but again, that also leads to a questioning of medical experts, of medical advice given to us by these non-scientists, because overall we can't trust it. It's a matter of bioethics, ethical considerations, where we must listen to our professionals first and foremost. So, without further ado, the summary that I'm going to be relaying into is that there is a relationship that exists between the medical community and the society, but again, the medical community is the ones that need to develop our main backbone to how we view medicine. The society can influence it, but it should really stay out of the real proceedings of how we develop cures for certain diseases such as coronavirus or ALD. So Hugo Moser and all the medical experts treating coronavirus in the hospitals are who we should trust. Lorenzo's case study and the misinformation regarding COVID-19 cures can definitely be compared, and as seen in this very own module, Health and Society, all research is of benefit, since the ethical issue that could be used to provide lessons for us will prevent us from doing certain things in the future. And here are some references. Thank you.